Opioids and how they are affecting our community. Opioids are a word that we hear far too often. They have affected our lives in many different ways. Whether we have lost a family member, a friend, a coworker, an old classmate, it affects us all from different standpoints. There have been many lives taken, many people that have lost friends and family members, many that see the control it has taken on their lives, and many that watch as the people they love become someone they don't recognize. These are the people that need support now more than ever. They need a helping hand, someone to talk to, and they need to be able to depend on a healthcare professional to guide them down the right roads to gain recovery. Acute and chronic pain is a frequent diagnosis, a common diagnosis that providers prescribing opioids to patients, even sometimes without proper evaluation. I have seen instances in which providers genuinely care about controlling their patients' pain, and there are some instances they say yes to whatever they ask for just to push them out the door. There is not a single healthcare professional that has not come across a patient with some type of pain. Unfortunately, one of the things that ease their pain can also cause it. Every prescription pad can be a source or for a potentially dangerous and addictive drug. We hear a lot about how providers have caused this opioid epidemic. This is actually one of the oldest central duties that providers are charged with. Opioid abuse is one of the most consequential public health threats in the United States today. Drug overdoses have increased over the past 2 decades due to the role that opioids have played in healthcare. In 2018, there were close to 68,000 drug overdose deaths, in which 70% of them involved opioids. These statistics, however, barely scratch the surface of the opioid epidemic. This has created a despair that is indescribable unless you are a person that is going through it. This epidemic has produced a domino effect of negativity. The DHHR has even raised an eyebrow and declared this a nationwide public health emergency. The CDC is committed to fighting the opioid overdose epidemic. They work together to identify outbreaks, collect data, respond to overdoses, and provide care to other communities. The CDC even funds a program called Overdose Data to Action. This program is a 3-year agreement that funds health departments in 47 states, Washington, D.C., 2 territories, and 16 cities and counties for surveillance and prevention efforts. Unfortunately, fixing the problem of this epidemic is a lot more complicated than it seems. We have to keep in mind the harm that could be done to the patients being treated for chronic pain. This prevents suffering from pain, but is nearly impossible for some patients to just stop using them. This would trade out one crisis for another. It would go from an opioid crisis to a pain crisis. There is some evidence following opioid therapy that it can actually increase someone's sensitivity to pain. The question is, should we use opioids at all? Chronic pain can lead to a life that makes it hard to live. In turn, this could cause an increase in suicide rates. There are patients who have been on high doses of opioids for years or even decades. This can truly pose a serious challenge. There are such mixed feelings about opioids. Some believe that they are saving their lives, and others are terrified that they are going into withdrawal if their medications are taken away. Then you end up posing a risk that the physician will take their medication away too abruptly and just abandon these patients or even force them to taper before they are ready. This is a long and torturous process. It must be very well managed. The healthcare system created these patients, and it is not fair to turn our backs on them now. I think responsible prescribing is so important. I think we must recognize the patients that are coming in just to get pain medication versus the patients that truly need it. I feel like providers could be more mindful of the effects of these decisions. This could truly turn the patient's life around in a very negative way if they are not careful. Unfortunately, the evidence of the opioid epidemic has proven that they must be more careful in their decisions of prescribing. Do I think physicians need to be anti-opioid? No, I don't. I do, however, feel like they must use their license to be an advocate for a patient rather than not being mindful of all the things that could potentially happen to the patient during this therapy. Clinicians should prescribe opioids only when it is appropriate. It is so important to employ non-opioid pain management strategies. Evidence supports the use of acetaminophen and ibuprofen. It's also important to refer to physical therapy, recommend exercise, acupuncture, meditation, and yoga. There are so many non-pharmacological interventions that providers can show patients in order to control their pain in other ways, especially patients that do not necessarily need opioids to treat their pain. Pain is one of the most common reasons that patients seek help from their physicians. Studies show that over 25 million Americans suffer from acute pain and another 100 million suffer from chronic pain. Ethical considerations that we need to be mindful of. Beneficence is something a physician should seek to help patients by implementing clinical therapies that benefit the patient's health. Physicians should be advocates for patients, and pain relief is no exception. Opioids are proven to help, but they do not have any evidence that states it is effective in treating long-term chronic pain. There are no studies that state that pain management regimens last longer than 16 weeks. After evaluating the patient thoroughly, the provider is able to provide the patient with benefits of opioid therapy along with non-pharmacological methods that would be safe and even effective in managing this pain. If the physician does not feel comfortable in treating this condition, then the provider should refer the patient to a specialist that will be a better person to treat the condition. Non-maleficence requires that the patient does not do any harm to the patient. Above all, do no harm. The provider should be aware of the consequences that are involved with this treatment in order to provide the best possible care for these patients. The same mu receptors that are responsible for the analgesic effects of opioids are also responsible for their addictive properties and dangerous side effects. That is why this is the provider's responsibility to evaluate how this is going to be the best possible treatment for the patient. They must realize there is a balance in treating pain, avoiding substance abuse, and addressing a tolerance to these types of medications. Tolerance may also exhibit the same behaviors in those that are drug seeking, or of those that are drug seeking, and of those with substance abuse disorders. As part of avoiding patient harm, physicians must be sure to avoid causing any dangerous side effects. It's also important to consider other medications and therapies that could benefit the patient without the use of opioid therapy. This could cause less risk for the patient. Justice requires that all patients be treated the same. I think that is a big problem in today's society. I've seen providers prescribe these medications to patients and then turn around and talk about how frustrating it is that they are only coming in for their medications. I do not feel like that is right. There are the ones that have prescribed these medications, and I think that if they are willing to do so, then they must consider how treatment is going to go from that moment forward. I think patients need to be more, or physicians need to be more aware of their own potential bias in treating their patients. Lastly, I want to talk about autonomy. This gives the patient the right to make decisions regarding their own health care. For example, a patient may be taking opioids for long-term chronic back pain. The patient may go to a provider that does not prescribe opioids for treatment. The patient may feel like their previous provider's treatment plan is more effective than the one this provider is willing to put them on. This may cause a dissatisfaction between both the patient and the provider. Both sides may have conflict and difficulty when it comes to agreement on the best treatment. So this will give the patient an opportunity to go back to the other provider or even stay here. That's one of the benefits in being able to choose your own healthcare treatment and your own provider. When it comes to ethics, clinicians have the duty to do no harm. They must uphold the ethical principle of non-maleficence. It is the provider's duty to not impose the risk of opioid addiction, overdose, and even death secondary to use of prescribed opioid pain relievers. This justification will prioritize the benefit for the patient by temporarily not treating the patient's pain to avoid future harm. The merit in this situation is to reduce the risk for all patients, to have justice, beneficence, non-maleficence, and autonomy that support adequately treating pain with the appropriate medication treatment. It is so important to keep the patient's best interest at heart. It is important to determine the risks and benefits of prescribing opioid therapy to the patient. We must be an advocate to the patient. We must determine what is best for the patient. If opioids are the best benefit, then the clinician must prescribe them responsibly. That is the only way to cure this epidemic.